put some anti-sensitive material on,
above the
on the neck of the teeth, and that's all. But if the problem is that the cement under the crown is resolved, so you have to take it out and make another one or re-cement it.
Oh.
Okay. Other than crowns and veneers, what other parts do you have in cosmetic under cosmetic dentistry?
Now we can talk about gum cosmetics.
Yeah, what is that?
Yeah, some people in the Middle East here has some dark pigments on their gums, and if this patient have some what we call it gummy smile, like when he smiles,
the gums are
So then we have to treat this problem because it's actually very ugly. So nowadays the treatment of this thing is very easily treated by lasers, some kind of lasers, without pain, without anything.
Yeah. Oh.
What results in this blackness, other than smoking, of course?
Actually, it's genetic.
It's genetics.
Comes from
it's
the parents,
melanine pigmentation, like the
color of the skin.
Sometimes you have to see some dots on our skins.
Yeah.
It's the same material which exists, so we can remove it. But the problem that it might reoccur after 2 or 5 years, and you can remove it again, no problem.
Do smoking also gives you the black layer above your gums, right?
Actually, smoking has many problems.
Yeah.
On the
teeth, yeah.
On the teeth and the gums, actually, everything.
Okay. My question is that I know that genetics, anything that is genetics, it's hard to change, or it's hard to take it off your skin.
Yeah.
So do you find more problem in removing that blackness in the genetics, or in the smoking you find it easier? You know, I mean, in smoking, is it easier to remove the blackness on the gums?
Smoking is very hard and difficult because the smoker will not stop smoking. That's the problem.
Yeah, that's
Otherwise, if he stops smoking, the treatment will be very easier. But about the genetic problems, you can manage it very nicely, because sometimes some people has like genetic problems, like they have 4th molar, not only the wisdom tooth. There is one tooth more, or here or down. And you can remove it very easily, and it's a genetic.
Yeah.
The same.
It doesn't come out later on, or it doesn't come out later on.
No, it's it's once.
I have that question.
Yeah.
They say that whenever your teeth goes down, or it can't go, you only have one chance.
Yeah. It can't go back.
Yeah, like for example, you have a kid and that kid's tooth went out, so he gets another teeth, right? So he can, like that teeth, if it's gone, if that kid lost that teeth, it won't come back again. Is that
the
true?
other tooth?
Yeah,
of course.
The second one. Really?
Yeah, but
why?
I will tell you something which we heard before from some people before I was
before you became a doctor.
Yeah, before I was in the college, actually. They said, okay, after removing all your teeth, sometimes when you get about 50 or 60 years old, you will see other teeth
coming out.
Yeah, coming out.
Yeah,
it's truth. Yeah, you know how?
How?
The problem that
from the calcium, is it?
No.
What?
There are some impacted teeth remaining sometimes with some patients inside their bone.
Yeah.
So after he lose all his everything, and the gum started to make recession, and it will erupt. He will think, oh, I have the chance to get new teeth.
But you only have that.
It's all tooth, but now it erupted.
Really? Well, that's really
I have a question.
Nice.
I do hear about some actors and actresses that they remove all their teeth and then put a new set for a brighter look, or to be just
to have a Hollywood smile, as they say.
Hollywood smile.
So that's true, or
they don't remove their teeth. And we thought before that some of them, they are removing their teeth.
And they put
no, they are not changing anything.
It's the veneer, right?
This is the veneers. If it's in one day, it's the veneer.
Yeah,
and sometimes you can, within one day, do
you can't change the whole set of teeth.
Somehow.
So, but let me ask you a question. Since we talked about the veneer and the crowns, whenever like there are things you can't have them whenever you have these things in your mouth. For example, the veneers. Whenever you have the veneers in your mouth, you can't like drink dark things, like for example like coffee or like Coke or anything like that, because it will get darker a little bit. Is that true?
Actually, you can drink. You can.
You
No
can,
problem.
but you don't want to ruin that whiteness.
No. I will tell you something is that the veneers, the ceramics, they are affected by like drinks less than the natural tooth or natural teeth.
Oh, yeah.
So don't worry about this. But but the problem they are affected too with
They get affected, yeah.
Of course.
And whenever they get affected, how do you manage that? You
Just
go back
only-
and change it?
No. Sometimes you can just polish it and that's all.
Repolish it?
Yeah, but in the clinic. Not in
Yeah,
the kitchen.
definitely. Of course, definitely. And how about the crowns? I think they're called right that.
Yeah,
right?
there are many kinds of crowns.
Yeah.
Nowadays, the people and dentists tend to make metal-free restorations or metal-free crowns because before and until now,
Yeah.
Dentists do PFM crowns. It's called porcelain fused to metal,
Oh,
and metal inside, and the metal is covered with
the
porcelain.
yeah.
So it's better because now the material science is developed very nicely. So they offered for us very strong material.
Yeah, high quality,
without-
let's say.
Yeah, it doesn't need the support of the metal inside.
Oh,
So because the metal sometimes it make the gums darker in the same or in the place of the.
that's
crowns.
why they're not using it nowadays?
Yeah, they are trying not to use it, and dentists trying to replace it with new crown zircon or Empress.
Do they have
Yeah.
any disadvantages?
The metal free?
Yeah.
No, at all. Of course, the crown itself had some disadvantage as what we mentioned now, that you are grinding the tooth.
Yeah.
Yeah.
Okay, but it's okay because it's in need. So
Yeah,
that's why we
definitely.
grind.
You don't put it for like.
Yeah, of course.
Yeah. Okay, since you mentioned metal, what is that thing that we used to see our grandparents and they put it in their teeth? It's like a metal tooth or a golden tooth, a silver
It
tooth.
was like moda.
Well, yeah,
Yeah.
exactly. It was fashion.
Yeah.
So what
Like
is
gold
that?
teeth, yeah.
Yeah, a gold teeth, and they smile. They try to like, come on, see my golden teeth.
Until
What
now,
is
there
that?
are some cultures make like this. When they come to Mecca and Medina.
Well, yeah, definitely.
They are asking for things
For
like
a
this,
golden
and
tooth, yeah,
of course
that's
we
true.
don't offer now because
I
it's
need your
finished.
answer for this, but of course, definitely, we have a report that we have a report right now. I will get the answer, but after that report, so don't go anywhere. Just stay with us.
And of course, this is like Tuesday episode, taking care of teeth. Sir, my question here, do you think that food really affects the strength of the teeth, and does it cause a lot of problems for teeth?
Not the natural foods, the chemicals and sweets, a lot of sweets, and if somebody do not brush the tooth twice per day at least, I think that will affect the mouth and the health of the humans.
Would you like to say an advice to the kids?
They have to keep away from the junk food, fast food, and they have to brush the teeth at least twice per day, especially before going to sleep. Try to sleep early, not drink a lot of, do not eat a lot of ice creams.
Yes, of course, and it's a problem, big problem. And ice cream and eat so-called and it's.
Do you think that food really affects the strength of the teeth, and does it really cause problem, afterward?
Yeah, I think food it's not important to the health. It depends on kind of food. It's not about how much food, kind of food. I mean, if you take healthy food, you'll healthy body, and opposite is right.
Welcome back. We just had a report about asking about, of course, the tooth and does the food play a role in decaying the tooth? I would like to, of course, to take this question to the professor.
But before we take that, we really thank whoever did the report, and yes, thank you a lot, and for all of who participated on it. But before we go, please, about your question, I really